Thank you very much for joining us for this very special edition of Protect Our Province, Alberta. Today, I am very fortunate to be able to welcome one of our Protect Our Province, Alberta experts, an engineer who has been creating something that has been really, really helpful for me throughout the course of the pandemic, a scorecard. It's balanced. It looks at where we were, where we are. That way, hopefully, people will continue to look towards where we're going and what we can do as individuals and what our policymakers can do to prevent some of the mistakes and take some of the learnings from the first to the fourth waves. It is with great pleasure that I welcome for this special edition, Ziad Fazel.
Thanks, Michelle. Thanks, Chad. And yeah, I'm glad for the opportunity the Pop Alberta team is giving me to show you a little bit more of how my scorecard works. I tweet it every day that the stats come, sometimes a day later. And I'm glad I got a chance to show you a little bit more how to interpret it and under the hood. So you should be seeing us go from like a contact sheet view to now just the scorecard itself. That's okay. So I have been doing the scorecard since the beginning of May, and I started it because I saw us at the peak of the third wave, and I wanted to help the Alberta government and the people of Alberta look at taking a balanced set of metrics for bringing us down from the third wave, and then not repeating the mistakes of the second wave, having a set of metrics and some limits upper and lower on when we apply safety measures and when we remove safety measures. Unfortunately, the government didn't learn from me, and we have this worst wave ever. So the scorecard is balanced with balance of leading indicators and current metrics, and then severe outcomes, what people sometimes call lagging indicators. And then I also show the vaccination. That's not a measure of the pandemic, but it's an important stat that is good to have beside that. The rows on my spreadsheet are these metrics, and the columns are the dates and times. And at the end over there, there's a trend I can talk to. So the first item is the leading indicator of R. And as you can see, as we go across that row, all the way to the red column at the end, R has been floating between 1.05 and 1.1, and currently is at 1.08. Now that seems like a small little number, but any number over 1, when you have this many cases, is very dangerous. We're only 4.4 million people in the province. We're having 1,650 cases on average. I know 2,000 is something that today, but the weekly average. And this 1.08 is a little bit like having an RRSP that's doing 8%. I'd love to have that, and when I'm hopefully old enough to retire, I'd be happy if my RSP was doing that kind of performance. So there's good growth and bad growth, and R like this is not good growth. The next metrics are current metrics, and they're measuring the current state. So one of the analogies I use is that we're a canoe on a roller coaster. So if we were being governed well in a zero COVID or stamp it out kind of a system, we wouldn't be on a roller coaster. But because we are, we're on a canoe where the front end tips up and then the back end tips up and the front end tips up. So this current metric is on the front, and it's the test positivity, and we're about 1 out of 8 people testing positive. And that's gone up 17 times since the 11th of July. So we were getting about 1 in 180 people testing positive, and now we're getting 1 out of 8. And you can just imagine if that were to, let's say, become part of your family doctor's offices, what chaos that would cause. The next item is daily new cases. So as I said, this is the 7-day average, and it's just going up consistently. And I'll show you a bit more why that is. Hospital, we're at an all-time pandemic record. 911 is a good number to have. It's an emergency. ICU, We had a bit of looks like a dip today, but given how busy ICU is with people scrambling to save lives, they might not be caught up in the stats. And the deaths showing for the week, the last 7 days, is 79. So over 10 Albertans a day are dying from COVID. And we might see those stats change as well after the weekend when people can settle down, I hope. And fully vaccinated people was going up by 0.1% every day, like clockwork, for the last number of weeks. So it went up by 0.2% and keep her going. Leading indicators. So the blue squiggly line at the top is R, which is that measure of the rate of reproduction of the virus. And that's measured on the right axis here that goes between 0.5 and 1.5. So you can see R is kind of in that 1.1 zone. And then on the left axis that goes between 0 and 3,000 is the current indicators. So this is things like test positivity, which kind of has flattened out here on the right, and the green daily new cases, which is soaring. So, we're in a pandemic and we're trying to see what's coming. So one of the best measures for that is R, which comes from a very respected statistician named Ryan Imgrund in Ontario. And he's kind enough to now do R across Canada. And he's collecting statistics of symptom onset from people who are then testing positive. So this is about 5 to 7 days ahead of the current test positivity. So it's a little bit like a scout in front of the canoe, whereas test positivity is the canoe. Another leading indicator. So again, this is me looking for information that gives us more of a sign of what's coming than when somebody tests positive. And this is the wastewater. So University of Calgary is doing wastewater sampling around a couple of Calgary hospitals, and they're baselining to the city in general to be able to compare hospital spread to city background. So you can see the green columns are the wastewater measurement, and there's a spike there in the middle of July, right under the blue bump in the Calgary R. And then if you look to the right, you can see the green columns going up very steeply. I'm not sure about exponentially, but going up steeply. So what that first middle spike is that matches the blue spike is Calgary Stampede. So the Stampede was from the 9th to the 18th, and that's showing up in infections, and then the infections show up in the wastewater. So if you get infected on one day, it shows up in your waste the next day, which is captured from the sampling, and then you feel sick, you go get tested. So wastewater is about 6 days ahead of the test result, as is Calgary R. So you can see they correlate well together. And if and when the provincial government actually does surveillance and releases the wastewater sampling they're getting from the University of Alberta and have been for many months, we'll be able to see what's happening upstream, if you'll excuse the pun, with wastewater around the province. So far, all the government is allowing to be released is the UOC project that's done jointly with AHS. We're not allowed to see the University of Alberta project, which is all over Alberta. It's not something new that has to start. It's just, are they going to publish it or not? So going over to the right half of the graph again, we see R kind of flatten out. So the speed of spread is kind of flattening out, like we're not pressing the gas as hard, but the car is already at a very high speed. And that's why we see a large number of active cases, and these are infected people pooping, and a higher amount of virus sampled in the wastewater. So this is a graph from the University of Calgary Centre for Health Informatics, and it's test positivity. So the blue line that goes following waves is the test positivity, and you can see it cranked up in the right corner at nearly 12%. And then the brown columns, like a fence, are the number of tests that are done daily. And so if you look, last summer is between first and second wave, that flat part there between the two waves. So even though test positivity was more or less flat and at a not scary, 1 to 2%, the test volume was going up. So Albertans were feeling sick. They were feeling symptoms. And so they were getting more tests done. And as a result, daily new cases rose through the summer into the fall. And that was a sign of the second wave coming. And there's a little spike here in the rise of the second wave, or little dip in the number of tests being done daily. And that's when the Alberta government said, no more asymptomatic testing. So if you're not sure whether you got sick or not, too bad. We need to save the capacity for symptomatic testing and exposures only. So that's the way it's been since. As you follow the blue line down the second wave and up towards the third wave, you can see a bit of a lag. So second wave, the test volume is leading the test positivity. In the third wave, the test volume is lagging the test positivity because the government is reducing the types of reasons for which you would get tested. Then we look at the fourth wave with this very sharp rocket of test positivity, and it takes a while for the test volume to catch up. And around this time is when the government tightened the criteria for getting tested. So it wasn't just you have to have symptoms, you have to have really strong symptoms. And contact tracing was cut here as well. So you didn't have people coming to get tested because they were told by AHS contact tracers that you've been exposed to someone positive. So, a lot of people are walking around blind, not knowing that they were exposed. And with a 2-dose treatment of vaccine, you are less likely to have symptoms, but just as likely to be infected. So it's a little bit of a silent carrier problem. I can see why our health experts, not in the government, but with POP Alberta, are saying we need contact tracing because of people who are walking around transmitting asymptomatically. And what does that mean? That means we have severe outcomes. So I'm just going to skip back to the leading indicators. So I've got this little arrow here in the left corner at July 1st. So what I've done is I've said, whatever test positivity was or number of daily new cases was on July 1st when things were fully opened up, that's 100. And so you can see it kind of goes down a little bit more until the 14th or 15th of July. And then the usual exponential growth curve goes up. So there it is, 14th or 15th, so about 2 weeks after the restrictions were lifted. And we can see R rise then. And we can see the test positivity rise then. And the 26th or 27th of July is when we see the severe outcomes, the people in hospital and the people in ICU, that bottoms out and then starts rising. So there's kind of a cadence. When you lift restrictions, about 2 weeks later, your leading indicators, your test positivity and that bottom out and then turn upwards. And then 2 weeks after that, your hospitalization bottoms out and turns upwards. And about a week after that, your deaths per week start bouncing up. And we see this wave after wave. Didn't have that much stats in the first wave. We were caught off guard, but we should have been prepared for second, third, and fourth wave. And this is the cadence. You lift restrictions, 2 weeks later, your stats bottom out on leading indicators, and 2 weeks after that, your lagging indicators. So be careful when politicians say, oh, we're bending the curve, or this is going down still. And, look, we lifted restrictions, and 3 weeks later, things in hospital and ICU are still going down. This is a pattern like clockwork. Just one more thing on that. It's a little bit like a gas burner, which doesn't have a 1 through 10 on it. It has safety measures on it. So when you turn up the safety measures, the heat goes down. When you turn down the safety measures, the heat goes up. So once you figure out that this gas burner is kind of wired backwards, that when you want to be safer, you turn up the safety measures. After 3 waves of practice, we should know by now. Turn up safety measures, heat goes down. remove safety measures, heat goes up, kitchen catches fire. You're in the house saying, my kitchen's on fire, but we'll learn to live with it. So the next slide here is showing the hospitalization mountain in orange and the ICU mountain in pink. And we're in record territory above not just the third wave, where we had vaccination helping people from Alpha, but the second wave when we weren't vaccinated. Only later into the second wave were we vaccinated. And for all three of these waves, it was not vaccination that brought the curve down, it was restrictions. So the severe outcomes go down from restrictions 3 to 4 weeks later, and then they go up again. And here's ICU, and I wanted to show you this because look how steep that is. So from the 1st of August to the 15th of September or so, our stat 16th, ICU has gone up 12 times in those 51 days. And it's so much steeper than the other curves, despite we're about 60% fully vaccinated. And for the second wave, we were not vaccinated, but wearing masks. For the third wave, we were wearing masks. And we were largely 50% or so with one dose to protect us against Alpha. So, the seniors who were being hit, the most vulnerable, they were okay. But now, despite our high levels of vax, 61% of our population is fully vaccinated. This ICU spike, steeper than the other ones, is the sign of going without restrictions. The ICU capacity and utilization graph. So this has become a way of viewing the statistics that people in Alberta seem to like. And I appreciate Dr. Schwartz, an infectious disease doctor, using this as his reference to talk about the scale of the problem. So on the vertical axis is the number of Albertans in ICU just from COVID-19. And then we've got the dates across the bottom. And this blue curve, the faint blue with the little dots on it, the numbers on it, is the actuals. And then the darker blue smooth curve is me fitting a quadratic expression to that exponential growth. The gray line across the bottom at about 31. So before COVID, the worst respiratory breakout we had was the 2016 flu season with 31 Albertans in ICU from the flu. And Dr. Verna Yu, this AHS CEO, showed this graph in the third wave with much lower numbers when the record was only 186 Albertans in ICU with COVID. And we were never supposed to do that again. Vaccines and knowledge on how to suppress COVID-19 was supposed to stop it. And yet here we are. So that red line across about the middle is the baseline ICU capacity of 173. That's the baseline capacity. We're looking at the surge capacity a lot in the media reports, and in the thankfully AHS is being very candid with us about it. But in reality, our ICU capacity is lower than 173 because our staff are burned out. They're physically burned out, they're emotionally burned out, they're suffering nosocomial or hospital-based infections as well. So we have fewer people stretching to cover more patients. And that gold orange line that's jumping up across the top, that's the surge capacity. So this is AHS doing everything they can just at least get people a bed. And then, we'll solve the other problem of getting staff to that later. But first, at least have a bed to put these people that are coming in at an exponential rate. So the surge capacity now has been raised to 322, and we're using 260 out of it. And I'll commend AHS on this. They've added enough surge capacity that the date in which the trend exceeds the surge capacity is pushed out now to Thursday, the 23rd of September. I believe before it was Tuesday, the 21st. So at least theoretically, we have enough beds to put the people who are coming in sick in exponential numbers. The hard part is getting the staff to do that. So lots of surgeries canceled, lots of procedures canceled. People from all over the hospital, retired people, everybody who's ever been a healthcare worker is being drawn in for this crisis. And up in the box, kind of in the upper middle there on the left, the previous record surge capacity we had to build was 270. We're now at 322. So that's 62 cases more, or almost a third of our baseline capacity. And our previous ICU population record of all causes, not just COVID, but heart attack, surgery, recovery, car accidents, was 247. And now we're at 260. So I take some good news that this faint blue actuals went from 220 to 215. Partly that's from stats not catching up to very busy people. And we're still in huge trouble compared to our baseline and compared to our burned out healthcare workers' actual capacity. We're not just seeing patients get sick, but healthcare workers get sick. And I'm worried. I'm worried about our colleagues in healthcare. I'm worried about what this will cause for them dealing with death and also dealing with the stress of trying to keep people alive within the constraints. So here is Alberta Health's graph for deaths per day. It's hard to see, the trends from this picket fence, but larger trends you can see. So the last couple of days, we're at around 13 deaths per day. And if you carry that line across, it blows above the third wave. It takes us back to the early part of the second wave. And if you look again to the right at how over the 1st of September, it's spiking up like that, it's steeply growing. If you look at the 1st of November, from the second wave, we're growing steeper than that. So the second wave had a lot of deaths that we're supposed to have learned from, and we're doing it all over again, despite all this vaccination we've had. So what does that mean? In many ways, Alberta is the sickest province of Canada. And it's sick not just in how Albertans are being affected, but it's sick in the way it's being run. So you don't get to have the most deaths in Canada in the last week, more than twice as much as BC, nearly twice as much as Ontario, about 35% of, 40% of Canada's total. So when you look at what a good healthcare system we have, and the Premier claims a very expensive healthcare system, to have this kind of death is, as Dr. Vipon says, an intentionally cruel wave. So I'm going to come back here and sort of show you these numbers again. In the very right side here, our hospital has gone up more than 11 times in 54 days, and our ICU has gone up nearly 12 times in 51 days. And I just want you to think about anything where you've worked in that capacity, whether it's people coming into a hall where you're working, or people coming to a wedding, or people on the road, and you think what it's like to handle growth 11 times and 12 times in 50 days in less than 2 months, how you would be able to cope with so much coming. Let's say people coming into a wedding, and it's 11 times what you expected, and you got to pack them all into the hall. I imagine that's people who are life and death. So I wanted to show that. That's it.
Thank you so very much for your time today, your dedication to keeping Albertans safe and informed, and using your skills to help make that narrative accessible for everyone across the province.
Thanks, Michelle. If I could say, from my position, it's a little bit like sitting in Calgary and hearing that being told by the government that the wildfire season is over, there won't be any more property damage, there won't be any more casualties, and seeing the reality. So seeing their models versus the reality. My graph of ICU capacity is the actual stats, and the trend line that I show is from the actual numbers. It's not a model with phony inputs that make it pan out flat. I'm in Calgary and I'm looking over at 1,000-kilometer high fire, or 1,000-kilometer wide fire, coming in at 80 kilometers an hour, roaring down from the foothills. So I'm seeing that, and it's stressful for me because my view of R and wastewater days ahead of the schedule is kind of showing me that fire coming, contrary to the government's message. And it hurts me to see that in advance for the people who are trying to save lives here.
Thank you.
You're welcome. Thanks for all the time.
Thank you for the hundreds upon thousands of hours that you have taken to help make this information available to Albertans. That way they can plan for themselves and their families and those in their circles who they can reach to stay as safe as possible as we continue this upward trajectory.
Thanks, Michelle. Thanks to the POP team. I really appreciate what you all do.
Until next time, remember, COVID is airborne. Wear the best mask you have access to. And vaccinations really do save lives.